It's been a morning of thought-provoking conversation, and before we wrap up, I'd like to invite to the podium Michelle Wang-Goodrich, President of the Central Nervous System at Janssen Pharmaceuticals, for some closing thoughts. Michelle.
Well, thanks to everyone here for joining us today, and thank you for all of our panelists for a very thought-provoking discussion. Now, we're very grateful to have this opportunity to foster very meaningful dialogue focused on ensuring access to care for those with serious mental illness, and to inform the conversation around policy solutions that can be focused on earlier diagnosis, earlier intervention, and continuity of care. And since our founding in 1953, our organization has remained at the forefront of advancing central nervous system treatments and improving care for patients with brain disorders. And at the same time, we recognize that medicines are just one element of putting people with serious mental illness on the path to their recovery journey. Beyond our innovative medicines, Janssen has programs around the world committed to public education, policy reform, community support, and fighting stigma around serious mental illness. In the United States, we're actively engaged in public policy initiatives that seek to elevate the standard of care for those with serious mental illness by raising the need for reforms in our behavioral health systems, encouraging legislative change, and enhancing community programming. And one example of our sponsorship is of the Stepping Up initiative that Fred Osher referred to, which seeks to reduce the incidence of mental illness in our jail systems. And we believe that the paradigm can be changed by shifting the focus to earlier interventions upon diagnosis and ensuring that individuals with serious mental illness get the care they need at the right time and in the appropriate setting. Through the terrific work of all the people in this room, we've seen important progress for mental health care, including more than half of the states around the country moving from terminating Medicaid to just suspending Medicaid when individuals are incarcerated with mental illness. And this offers tremendous opportunity for improvements in transitions of care. I want to thank each of you in this room for your commitment to come to the table, to step up and lead the path for better mental health care. It isn't a straight path and isn't an easy path, but I know by coming together, by listening to one another, and by continuing to remember our common set of goals, we can do more to make recovery possible for those impacted by mental illness. So we applaud the Hill, and we thank today's speakers for their participation in this event, and we thank very much the National Council for Behavioral Health for their incredible support and collaboration. So 1 in 17 adults in the United States are impacted by serious mental illness, and they are counting on us. Judging by the compassion and commitment I've seen today, I know that together we can make a difference. So thank you again for being here today and for being part of this very important conversation.
Thank you, Michelle. On behalf of the Hill, our underwriter Janssen Pharmaceuticals, and the National Council for Behavioral Health, I'd like to thank you all in the room. If you missed any portion of the event today, it will be on video on thehill.com later today. And just a reminder to fill out your survey forms for feedback. Thanks so much. Have a great rest of your day.